Here at the London Orthopaedic Clinic, we understand that lengthy waiting times exist at accident and emergency departments. It's imperative for fractures and injuries to be diagnosed and treated by an appropriate consultant as soon as possible. Our consultants and staff take accidents and injuries very seriously. This is why we do our best to see patients as quickly as possible. If you have an emergency, we will always aim to see you within a 24 or 48-hour period. Once you are under our care, we will make sure you get the best service for your recovery. We are proud to have a highly skilled team of consultants who examine, diagnose and treat you very quickly. They are supported by our in-house radiographers who are able to provide the consultants with X-ray images within seconds. Our clinical team also provide a bespoke plaster or dressing service, as well as fit any medical aids the consultant may recommend. Let me introduce you to Irmi Moser. She's on our clinical team and performs plaster and dressings here. She's going to take you through some of our frequently asked questions.
It takes about 5 minutes to apply a cast. The casting tape dries very quickly, so it has to be applied in a certain time, and that's about 3 to 5 minutes. You should get a cast as soon as possible after a break, because your arm will swell up. It will also hurt because of the fracture site moving, so it is ideal if you got a cast straight away, really. The cast does not cut off any blood supply. When you first break your arm and you have a cast applied, it's only a so-called back slab anyway. It leaves enough room for the swelling, and only after a week, when the swelling goes down, we apply a full cast, and by then you should be very comfortable in a full cast. Yes, you can shower with a cast on, but you must make sure it's covered in one of those limbo covers. No, you should not get the cast wet, because if it's wet, it does not dry out underneath and it will destroy your skin. So if you get it wet, you need to contact us and we need to change your cast. If your fingers or toes go numb, you need to sit down and elevate your leg or your arm at about heart level or above, ideally. And you need to exercise your toes and your fingers to get the circulation going. That will reduce the swelling, and hopefully you will gain feeling back into the toes and fingers. If not, you need to give us a call and we'll probably need to get the cast changed. If the cast is too tight, you will feel it. It will feel restrictive, and if it's uncomfortable, you need to come back and have the cast changed. If it becomes too loose, you also need to come back and have it changed, because it will not support the fracture site properly anymore. And you just need to give us a call and we'll change it for you. The dressing should be changed as often as required, and what I suggest is you come in and we have a look at the wound and advise you on how often you need to change it. It could be every day, it could be every other day, or even just once a week, but we need to see the wound first. Well, if a wound becomes infected, you will know straight away, because it hurts more than usual. It goes red, it swells up, there might be pus, there might be some strange smell. If any of that happens, you'd need to call us and we need to take a look at the wound. Or you need to go and see your GP straight away. We will take a wound swab, and you might need to take antibiotics for that. Itching and burning together is not normal. It might imply you've got an infection. So again, we'd need to take a look at the wound. Itching alone sometimes is a sign of wound healing, which is a good thing, of course. But in any case, give us a call and we will advise you on that. You keep the cast clean by covering it up. If it's a below leg, a below knee cast, just keep a sock over your toes, wear long trousers. If it's a below elbow cast, also wear long sleeves and just try to keep it clean generally. Don't get it wet, don't get it dirty. If it happens, it happens. Just come back and we'll change the cast for you.